Coming up a little later in our newscast, how the Urban League is coming together to address violence in the community. Tonight, mothers and family members of those killed from gun violence in Birmingham, we saw them earlier standing with Birmingham Mayor Randall Woodfin when he announced the Increase Peace initiative. All of the mothers wearing black T-shirts that read Increase Peace, some of them sharing their stories of grief in a special PSA.
I still have the clothes that he was killed in that night. And, you know, I pull him out and I talk to his son about it because he wants to know. He wants to know what happened to his dad.
It's Carolyn Johnson speaking about her son, Rodriguez. These PSAs are part of the Increase Peace campaign where loved ones left to grieve the aftermath of gun violence tell their stories in their own words. There is a ripple effect to gun violence beyond the lives lost. There are many lives of shooting victims who survive being shot. It touches them, it touches their families, and the medical workers fighting to save lives. Tonight, a closer look at the war on gun violence on the medical front from UAB Hospital's chief trauma surgeon. The level of gun violence in Birmingham is astonishing to the medical community.
We've seen a doubling in the number of patients we take care of. In the last 4 years, it's gone from 250 to 700 patients a year that we take care of with gunshot wounds in our community.
I sat down with UAB Chief Trauma Surgeon Dr. Jeff Kirby, whose staff sees gun violence every day, calling it an epidemic.
Typically, the way we deal with epidemics in this country is use a public health approach.
And what would that be?
Well, you need to study it. You need to do research. And the problem is the NRA has effectively lobbied to prevent any research to be funded by the government that involves guns. So we can't even get the funding to do the research because there's a prohibition against funding, government funding, to do gun violence research in this country.
And yank down nice and tight.
What Dr. Kirby is doing is going into schools to teach something called Stop the Bleed.
Stop the Bleed is a national campaign to teach bystanders how to apply bleeding control techniques. It's very much like CPR training.
People think about it in the context of mass shooter scenarios, but it is applicable to urban gun violence as well.
It absolutely is. The active shooter situation, the mass casualty incident, gets the headlines. But we're seeing this on an everyday basis. People are dying every single day from gun violence. And you can apply the same techniques on a one-to-one basis as you can in a mass casualty situation.
Training that could save a life in the 5 to 8 minutes where a gunshot victim could bleed to death. Dr. Kirby's team at UAB is working with the city of Birmingham to set up free Stop the Bleed classes in the community starting this spring. We have information on our website at cbs42.com. Just search Birmingham Increase Peace Campaign.